For the lung cancer in general, overall, the rate has gone down than say 20 years ago, but still this is one of the commonest cause of death among all the cancers.
Some of the common symptoms of lung cancer, especially in the early stages, tend to be cough, seeing blood with your sputum, chest pain, and sometimes in advanced stages you can have other symptoms as well.
The symptoms depend on how advanced or how localized lung cancer is. If we do a low-dose CT and we find a nodule that's pea-sized, you actually wouldn't have any symptoms, and that's the whole idea of doing low-dose screening, is to screen for lung cancer before you ever develop any symptoms for it. So the goal is to catch it at a very early stage. Early detection can save your life. Low-dose CT has decreased mortality from lung cancer by 20%.
The treatment options would be dictated by the stage at which you are diagnosed with lung cancer.
The most important thing in lung cancer is how far has it spread. So if the cancer is limited to the lung or maybe regional lymph nodes, surgery is the best option to try to remove it. If someone is not a surgical candidate with early stage lung cancer, they can have radiation. If it's more advanced and has spread to lymph nodes in the middle of the chest, then it's local regional disease. We usually treat that with concurrent chemoradiotherapy, so chemotherapy and radiation therapy at the same time.
In the past few years, we have learned a great deal about the benefit of immune therapy, especially in lung cancer. This is something that we are increasingly using, especially for patients with stage 3 and stage 4 lung cancer. Studies have shown that the longer you smoke, the more the risk of lung cancer goes up. And it's not just the risk of lung cancer, but a variety of other types of cancers like esophageal cancer, bladder cancer, some of these, and the cancer of the throat. These risks go up the longer you smoke. The good thing is that if you quit smoking, the risks of the bad effects of smoking actually goes down.
So since smoking is the #1 risk factor for lung cancer, the best thing you can do for yourself is quit. Unfortunately, not that many people can quit cold turkey. So what I always tell my patient is each cigarette matters. Have a goal, set a date, and go towards that goal.
For some reason, if you cannot quit, you cut down. I think e-cigarettes and vaping is equally bad. If you see, people used to think that, hey, if you go with the e-cigarettes or vaping, but people are finding out it can damage the lungs. It can cause similar problems as regular smoking.
I always say it's better to be safe than sorry. So if your symptoms are not getting better, you should see your doctor and have it checked out.